Good afternoon, everybody, to a Sunday live show which you all have been waiting for. We have with us, as always, Dr. Shashank Joshi and Dr. Harish Shetty, who are here to share their pearls of wisdom. Today, being a festive day, I would like to first wish all of you a great festival. And I would ask Dr. Shashank Joshi to first give an overview on what has been happening over the week, and then we will have Dr. Shetty give us updates on mental health. Dr. Joshi.
Namaskar, Aniruddha. I wish Guru Anna, Guruji, Namaskar, uh, a very happy Ganesh, and Aniruddha also a very happy Ganesh festival. Ganpati Bappa Moria, and पुढच्या वर्षी लवकर या we say, but we have to do Moria Moria to now really Corona and COVID. And I wish everyone who's watching us live today a very, very happy Ganesh festival. Jai Ganesh. And it is a Vignaharta, which means it removes obstacles. And our single common enemy on planet Earth today is the coronavirus, the SARS-CoV-2 virus. And let us hope that we have the blessings of Bappa, that we can eradicate COVID from planet Earth. With that in mind, we will try to see the overview of what's happening this week. Well, India definitely is doing much better this week. And we can see here that India is now reporting around 35,000 cases per day. And that's really the challenge which we are having. And it's still focused somewhere around Kerala, the hotspot. 75% of cases are coming from the Kerala state, followed by, of course, a lot of sprinkle, which is coming from Maharashtra. It's still number 2, unfortunately. Then we have Northeast. And then, of course, we have the 3 southern states of Andhra, Karnataka, and Tamil Nadu, followed by, of course, Bengal coming up. But rest of India is pretty clean, and they're out of the second wave. And clearly, we know that the second wave is still there. And this is Maharashtra now. And Maharashtra still has around 50,000 active cases. So Maharashtra COVID has not gone. And if you see the active cases, pecking order is led by Pune with 12,000 active cases right now, followed fundamentally by Ahmednagar with 6,000, Thane with 7,800. So Thane unfortunately has gone to the second number position. Then is Satara at 5,584. Mumbai is at 5,000. Solapur is at 2,800. Sangli has 1,400. And Kolhapur has dropped down. Ratnagiri has dropped down. So a lot of districts of concern have changed. And there has been a movement. And you can clearly see that Thane and Mumbai have crept up. And these are our current districts of concern. And that's where we are headed. And therefore, I plead you during Bappa time that double mask, and double mask. And please ensure that you complete both your vaccinations. That's going to be the order of the day. As we move, Tamil Nadu is seeing a rise now. Andhra and Mizoram are the only 2 states which are showing significant rise in daily number of cases. There are 35 districts, most of them are in Kerala, Mizoram and Maharashtra, which are reporting more than 100 cases. So predominantly across India, if you see, COVID is almost out. We have 700 plus districts. And clearly the weekly trends are showing a drop. There's almost a 10% to 13% drop of daily fresh cases in India, which are good signs for India. And let us hope that we can get out of the second wave and we can defer and delay the so-called very much touted third wave, which probably will come in December or Jan. And if we do things right, may never come at all. Next. Vaccinated people are 11 times less likely to die due to COVID and less likely to die get hospitalized. And this data came from a very elegant study which is published from Center for Disease Control and Prevention, which underscored that vaccinate, because the severe outcomes and lives can be saved because of COVID. Next. Clearly, what are driving COVID transmission worldwide? WHO says it's the Delta, and Delta. Delta is spreading as fast as chickenpox. It is vaccine inequity across the world. It is social mixing, and that is what we need to prevent. Avoid crowds, whether they are religious, social, whatever it is. Remember, our enemy is not the crowds. Our enemy is not the religion. Our enemy is COVID. We need to have consistent public health and social measures. And there's a lot of misinformation, particularly in the vaccine space. Remember, vaccine saves lives, but you need to, if you have a doubt, ask your regular family doctor. Next. What do we expect from the third wave? A lot of people predicted, but all these predictions have gone wrong, And we all know that there is Ganesh festival, followed by 5th of October, we'll have the Navratra period for 9 days. Then we'll have Durga Puja, we'll have Diwali. All these festivals will have something. And taking a general 2-week incubation period, a lot of people expect third wave to come mid-October onwards. That's really the prediction. And a wave of infections is dependent how people closely move together. So obviously, if people move in close quarters, how much they move, the first two waves saw the same patterns. And whenever the national lockdown was lifted, and there was the people moved into their hometowns. Second wave came in the heels of large gatherings around festivities and electoral rallies, and therefore third wave probably might have a similar pattern. So between mid-November to November 2021 is when the third wave may come, and we want to blunt it at any cost. We are determined. We are a very resilient and strong India. Mera Bharat Mahan, Atmanirbhar Bharat. We really need to support our Prime Minister, our leaders of all the states, including our Honorable Chief Minister, so that we can get COVID out from here quick and fast. The most important thing is my very close friend, endocrinologist, Major General Dr. Narendra Kotwal, wrote this very beautiful article in the Hindu called Gratitude. What has COVID taught us? It has humbled us. It has taught us gratitude. What it has taught us, as he said in his article, is mankind's inherent propensity was to be disillusioned, and gratitude is appreciating your life. It is essential for fulfilling life. It is like healthy eating habits, exercise, meditation. Gratitude is a practice which Guru Anna told us, and Dalai Lama told us we need to learn to want what we have and not what we want in order to get a stable or a steady happiness. It is very beautiful illustrated in this article, and I'm sure Anirudh will put it up, and all of you all go through this happiness. We need to be healthy and happy and blissful, and we need to be gratitude. Gratitude is something in the middle space, Major General Kotwal writes. And my final take home message today is coming from my endocrinologist friend, Dr. Mohan Shenoy. Mohan Shenoy has made a very beautiful acronym. It is called Shenoy Family. S for sanitize properly, H for have family time, E for eat and think healthy, N is for no for misinformation, O is for opt to stay safe, and yes is to follow governmental instructions. Because we are all in a rebellious mode. Thank you, Dr. Mohan Shenoy, for allowing me to have the Shenoy Pearls. And from one Shenoy, we are going to Shetty. They both belong to the same region. And Dr. Mohan Shenoy now will pass on the baton to my Guru Anna, Dr. Harish Shetty. And we have a special guest today with us who is going to join us. He's just going to join us. His name is Dr. Shashank Shah. But first, we'll have Guru Anna's Pearls of Wisdom, and then we will have Dr. Shashank Shah. He's a world famous bariatric surgeon who's going to join us on the show. Dr. Shetty, please.
Well, this was International Suicide Prevention Day on September 10th, and that's a very important day for mankind. In fact, the message was creating hope through action. And I am going to discuss whether we can have immunity against suicide. And as I say this, I get the icon Veer Savarkar, who had tremendous resilience to face the British terrorism and atrocity in Andaman. So, is immunity possible from suicide? Yes and no. We can build emotional wealth, we can enhance emotional hygiene, but those who are depressed and suicidal for various reasons, genetic and otherwise, need actually some amount of help, emergency care, medications, and counseling and therapy. So, all of us here should dwell on this concept. Is immunity from suicide possible? And as I say this, I would like to share softwares which you can actually inculcate. Resilience in the mind is equal to immunity against harm. And resilience in the mind is equal to immunity against harm is the second slide. And what do we do? I would say, I would request all of you to think about softwares which we can inculcate between the age of 0 to 10. And I would like to share these software just now. They are basically, when you talk to a child, talk with feeling phrases. I'll give you an example. Horrible child, you were supposed to come up at 5, you did not come. No, that's not the way to communicate. The way to communicate is, I'm so upset with you that you came up late. I'm so angry with you that you came up late. I'm so sad that you came up late. Or if you have scored 0 out of 100, I taught you all night, but you did not do anything what I said. Instead of saying that, I taught you all night, I'm so angry with you that you messed it up. Perfectly normal. Perfectly normal. So adding feeling phrases between parents will help children also share feelings across their life. And when they share feelings, what happens is you may have accidents, but you will be protected from catastrophes. Waiting for the turn, the ice cream game. I tell all families, Friday, get an ice cream to eat on Sunday, and you'll have children chasing you, using all the skills to have it on Friday. And then, when they wait till Sunday, they understand to wait for their turn. Waiting for their turn is extremely important to build frustration tolerance. And the third most important software, which you need to actually start, which Dr. Shashank started, sharing and kindness. Give a bigger tiffin to school so that they can share with everybody. When you share, your heart opens, your mental health improves, your emotional wealth also improves. Fourth is, my grandparents used to share stories from scriptures at night, and I would go to sleep. I never knew why they would say it at night, why they would share it at night. And actually, I also did not know across my life till I became a psychiatrist. Well, the unconscious is mildly open at that time, and the values go deep down the mind, and that is so important. The last software is nature as a mother. All children have two mothers, the real mother and nature as a mother. It's important actually to help children get wet in the brains, play in the grass, climb trees, and mental health is much, 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 much better. As I say this, also, I would also like to say that beyond this, there are many other things which are very important. I'll quickly summarize before my friend comes. Prayers get concentration. Festivals, when children are there, not during only the lunch and the dinner, but during the rituals, they run around, they remember their cousins, and those memories, those beautiful memories, remain all their lives, and they can access it when they're very difficult. Play and fun, of course, play and fun are softwares which should be inculcated much, much before they before the age of 10, because before the age of 10, it is impressions which remain all throughout life. Exercise is an antidepressant, mild antidepressant, and a stress buster. It also causes neuronal changes and neurogenesis, which means there would be increase in number of cells of the brain, also more connections, giving rise to great health. So, my dear friends, International Suicide Prevention Day, ask yourself, can you build immunity in your children against suicide? And that's the message I have for you today. And I'll still come back after Dr. Shashank Shah, our famed guest, and Dr. Shashank Joshi, two Shashanks here, share their pearls of wisdom and nuggets of wisdom.
Sorry.
Go
Thank
ahead,
you,
sir.
Guru Uma, for your pearls of wisdom. You always make things very lively, simple, and practical. We have with us today Dr. Shashank Shah. He's a world famous obesity specialist. He has been the past president of the All India Association for Research and Study of Obesity. He has been a pioneer in obesity surgery. He's one of the first persons to start the obesity surgery in India and discovered his own Dr. Shashank Shah technique. A lot of people come to me with obesity thinking that I am the operating surgeon. Actually, my namesake, Dr. Shashank Shah, is actually the operating surgeon. And he's based in Pune and Mumbai. So just like we have a twin epidemic of diabetes and hypertension, we have a twin, I have a surgical twin called Dr. Shashank Shah. And he is basically been the past president of the Obesity Surgery Society of India. And also he's attached to Sahyadri and Pune Hospital. He's attached to Lilavati and Hinduja Hospital. He's a bariatric surgeon. So we are in COVID time, Shashank, and we know that in the pecking order, the highest risk for people to die or get severe disease is obesity. So how has obesity changed your life, Shashank, and how has obesity impacted COVID?
Very good question. And first of all, I thank everyone for getting me on this platform. And I'm really lucky that such a famous endocrinologist has a twin name, and I get the benefit of that. So, obesity, I must tell you, was never taken as a serious disease by many people. And now I realize whenever they are admitted for COVID in any hospital, and when an attending intensivist says that your oxygen saturation is already low, you have sleep apnea, so you are at a higher risk. And that is when people started appreciating that, oh my God, this is really a serious problem. Obesity has given rise to diabetes, type 2 diabetes, hypertension, dyslipidemia, and respiratory disorder, and they are immobile, and their respiratory reserve is less. All put together, they become high risk for any disease, and COVID actually made it more prominent. We have had patients who were morbidly obese who never focused on aggressive treatment for their obesity. But once they got admitted, they were in the ICU, they needed oxygen saturation. A month after discharge, the first thing they did was they rushed to the hospital. But here, it's not only bariatric surgery. Bariatric surgery patients have had their diabetes in remission, their breathlessness was resolved, their hypertension got controlled, lipids got controlled, and those who have had bariatric surgery have had a mild disease, and many of them could get vaccinated and could even prevent the onset of COVID. However, this epidemic has taught us that this twin disease of obesity and diabetes needs to be treated aggressively, and it can make you serious in case of any infection like COVID or even any other disease. Treatment of a person with obesity, whether it is cancer or any other disease, becomes extremely difficult because of the weight, because of excess fat. Surgical intervention become more complicated, anesthesia becomes more complicated, even post-operative recovery, physiotherapy, movement becomes challenging, and therefore weight loss of any kind is important. First and foremost, like what Dr. Harish said, we have to start prevention right from your family, for your next generation, for your kids. If it doesn't work, maybe experts like Dr. Shashank Joshi can add some pharmacotherapy and treat them. And for those extreme cases who cannot be helped, bariatric surgery remains a scientific solution. And I'm happy to say that in today's time, it is fully covered under insurance, and the insurance regulatory authorities have declared morbid obesity as a disease, and that is a benefit for people. And I see more and more people now accepting it. But as a society in this show, we must understand obesity is a disease and jointly attempt everything possible to prevent another pandemic of obesity and diabetes growing in this country and in our state. Thank you once again.
Shashank, you were leading the movement in India. Shashank did three things for India. Number one is obesity. People only went to lose weight for cosmetic reasons. If they had to get into their right clothes for attending a wedding, then they went to an obesity specialist to lose weight. But they never recognized that this was a serious disease. That is the first thing. And you made that happen. Second is you ensured that the regulator recognizes it as a serious disease. And for morbid obesity, if you do bariatric surgery, it is a scientific solution, and you can remit diabetes. You can do remission of blood pressure. So just this week there was a remission consensus paper which came from Roy Taylor's group, and the U.S. Endocrine Society, American College of Clinical Endocrinology, the Diabetes UK, the ESD, ADA. They all recognize that diabetes remission is possible. And one way to resolve diabetes is surgery. Other way is lifestyle. Lifestyle is tough to follow. Surgery is not a quick fix solution. You need to have it, and both go hand in hand. But people who just can't make it, you have a solution available, and that's something which is there. So that is also very, very important. Yes, Vandana Gupta is asking a question: how many people who have had two surgeries and also death? Is it due to the carelessness of patients? Yes, we need to recognize that we need to be more cautious and careful, and also remember that most important thing in surgery, and I'm going to get Guru Anna involved here, is that in bariatric surgery we need to have a psychiatric evaluation. Without a psychiatric evaluation, they never operate. So, Guru, and now what would be your pearls of wisdom when you're handling a morbidly obese person? Because there is a lot of self-image which is damaged. And actually, Dr. Shashank Shah has a solution for actually having such morbid obesity people. But before that, the only filter which we need to do, and because it is the World Suicide Week also by WHO, it is important to screen these people from a psychiatric evaluation from a qualified psychiatrist like you. So, Guru Anna, your pearls of wisdom on that. And then if you have a couple of questions for Dr. Shah, and then of course we'll relieve Dr. Shashank Shah. He's doing a world conference here on nutri-metabolism. It's a hybrid model, and nutri-metabolism means nutrition metabolism. And he gave me a topic to talk here today called exercise does not make you lose weight. It is if you eat less, if you eat slowly, if you eat on time, if you have a large breakfast, moderate lunch, and a light dinner, you actually lose weight. What exercise does are only two things. Number one, it allows you to maintain that lost weight. And number two, the cardiorespiratory fitness reduces mortality and morbidity from cardiometabolic diseases like diabetes and heart attacks. So we'll first go to our big boss, Guru Anna. See, in this show, our big boss is Guru Anna, Dr. Harish Shetty. So he is going to tell us what are the issues related to image with people who are morbidly obese and how he filters them for surgeons. And then probably he might have a couple of questions for Dr. Shah, who is our guest today. You're
So
muted,
you're
sir.
muted, sir.
Sir, you're muted.
I think the first thing is people want a shortcut. There are many ministers who have had bariatric surgery without any mental health evaluation. And what is very important for every person is first screen, not psychologically, but also through a psychiatrist. Stress eating is extremely common. It can be actually treated. There are many patients on psychiatric medicines who have put on a lot of weight, and sometimes this weight cannot be reduced by altering medications or exercise or any other thing. They need bariatric surgery. Also, sometimes you have somebody who's very suicidal just because of self-worth. There is family history of obesity, and we can't wait till the psychiatric condition improves. Sometimes psychological treatment can take time, and that's the time when the bariatric surgeon, the psychologist, and the psychiatrist should take a mindful decision of when to operate and when and if to operate. The third most important thing is that so many patients who are depressed reach the bariatric surgeon first and the psychologist next. So a bariatric surgeon has to be very alert to pick up those signs of depression, probably a family history, probably related to an event or a trigger, and I also have not only a psychologist but a backup psychiatrist to see to it that he or she is treated. If the bariatric surgeon says no to a patient, he will get more patients because his credibility and integrity will be very high. So I think that is the key. If a bariatric surgeon is very keen to operate as many as he or she wants to, then you'll find that the credibility and integrity will really be damaged. So bariatric surgeon is one who knows when to operate and when not to operate, and that I think is the basic tone of bariatric surgery and the basic philosophy of bariatric surgery. Psychological evaluation for every patient is a must.
Thank you so much, sir.
Thank
So,
you.
Shashank,
Very well.
I want to ask you your take-home message for our viewers. Our viewers are doctors, healthcare professionals, people at large. What would be your messages to lose weight? Because I'm sure that even if people come to you for operation, the first thing they tell you is don't operate,
Don't operate. Very
and then they tell you what we should do to keep our weight fit. And you are so fit and trim. I've seen you for the last 2 decades. You have been the same. And
Very.
what is your secret of success, Shashank? Because and how have you remained positive? Because I'm told as a profession, the surgical profession was deeply affected by COVID for the last 1.5 years. So how did you survive? What was the resilience? What was the energy? What was the zest, zeal, and enthusiasm? And what are your simple tips? See, our people at large need to lose weight. So can you give some pearls of the Shashank Shah wisdom of your last 2 decades? How to lose weight? And of course, if they just can't manage it, of course, we know whom to come to.
I think this was a very important point and a message to be given. COVID pandemic did teach us when we are sitting at home, when we are at one place for longer time, we tend to eat more. So the best way to eat less is to remain busy, have some aim, have some goal, work all the time with something which gives you pleasure. It could be for pleasure, it could be for profession, but if you are fully occupied, then you can definitely forget your hunger and you can eat less, remain active, help others, enjoy helping others. That will keep your enthusiasm as much as possible. During this COVID pandemic, we offered free guidance and treatment to all patients of COVID, and at the same time offered emergency services to all those who had needed treatment for surgical emergencies when the apprehension of all surgeons to attend such patients without a COVID report was very high. There were accidents, bleedings, emergency admissions, acute appendicitis, and I focus on all those treatments. Most importantly, prevention is better than cure. So we have two best gurus here to teach us how to prevent obesity. And I think prevention, if we work on prevention and we try to prevent it in our kids, colleagues, friends, automatically we treat ourselves. We remain active, eat less, eat healthy, eat in proportion. Enjoyment should be occasional and not every day, would be my only message to everyone.
I
Thank you
think
so
beautifully said, Shashank. Meaning in life is an anti-depressant. It's a stress buster. Giving, the joy of giving, is universally an inoculation against mental illness and ill health. Thank you.
Thank you so much, Shashank, and
Thank
it
you.
was wonderful having you on our
Thank
show.
you. My pleasure.
Yes,
My
and
pleasure.
we are grateful to Dr. Shashank. He is now going for his conference talk. So best wishes for your conference,
Thank you.
Shashank,
Thank you so
and
much.
thank you so much for having
Thank you,
us.
Guru Anna. Look
Yeah.
forward to seeing
Thank
you.
you,
Thank you,
Shashank.
everyone.
Bye. Thank you. Thank you.
So we had Dr. Shashank Shah with us as a guest today. But Guru Anna, I am coming back to you. That mindful eating is a big thing now. And when you see food, you relish food. I'm sure on a Sunday afternoon it is very difficult to counter temptation. And food and temptation go very closely linked. And in COVID times, people due to anxiety, due to depression, they try to use food as a mechanism to eat too much because it is like it gives people relief. So how does one control the mind, and what is this whole concept of mindful eating, Gurana?
I think it's the war between the palate and the belly. It's a war between the palate and your body. What is your body? And when the war when palate is against the body and the body is against the palate, things go haywire. Mindful eating is when you decide here. You cognitively tell before you start your meal. Look at the plate in fantasy and look at the size of the meal which you are going to eat. When you look at the plate in fantasy and look at the proportion which you're going to eat, you weave it in your mind and you tell yourself this is what you're going to do. You're not going to really fall to the temptation of the palate, and immediately after the meal you'll walk away from the room, get into another room and wait for half an hour. That's one method they can do to really handle the war between the palate and the belly. The second most important thing is cognitive information of 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 food and the body, and reminding yourself what Swami Vivekananda said: eat less, eat more. What he meant was, when you eat less you live longer and you actually eat more. And cognitively also telling yourself that you need to manage your salivary glands, you need to manage the desire in the hypothalamus and in the brain. And how to do that? Second exercise is, keep in front of you a plate full of food which you love, which you can't actually resist, and just stay looking at them without doing anything. When you look at them doing nothing and you allow the thoughts, feelings, sensations, behavior to leave, what happens is slowly your desire also goes down. This is a good exercise for those who drink excessive alcohol. They can then sit with others who drink and they may not touch even a drop. The third thing, which is very important, is, as you also say, eat slowly, munch it properly, bite enough, swallow it slowly, and you'll find that your palate slowly gives in to your mind, and the mind wins over the palate. Sometimes you might cheat, sometimes things might go haywire, but on that day, you tell yourself, tomorrow I'm going to actually come back to my old habit. Also, do not stuff your fridge with all the food you love. Keep it away. In fact, I make it a point not to keep chocolates inside my fridge. I make it a point not to keep fried things inside the fridge. I make it a point not to keep things which hurt my health, which I'm not supposed to eat. And that also is good. Which means supply reduction, a philosophy we use in addiction, is also extremely important to be used in the war between the palate and the body. And that's what you need to do. Reduce the supply of the food which is actually available. So there are many more exercises which you can practice to really improve mindful eating. Thank you, Dr. Shashank.
So Vandana Gupta is asking, being at home for 16 months, people started honing their cookery skills, and more fats, more sweets were enjoyed and relished. Result was a fat buildup and diabetes. Staying home due to lockdown added to it. And am I making an excuse? Vandana ji, you're absolutely making an excuse. You must have good food, but you should share that food. You see, portion control is important. Taste is very crucial. Taste it and share it. Taste it and share it. If you are giving it yourself, you are a miser. If you give it to 10 people, you are making 10 portions out of it and giving it to 10 people. So all of them are relishing it. All of them will have gratitude. All of them will be happy. So become a taster. Become a taster, become a nibbler, but not a grozer. That is the key. That is the art of mindful eating. And if you master the art of mindful eating, okay, Vandana ji, you will be definitely in much better space because you will be happier, you will be healthier, you will be lighter, and you should be then doing, acts. Other thing is some people say, oh, doc, we just see our food, we just can't resist. We just gobbled ice cream, which Guru Anna was saying. Then what you do? You go and burn out that fuel. But remember, if you burn it out, you still can make it. So that's the way to go. Now, a lot of people have asked me two questions, Guru Anna. One is there anything new in COVID happening? Yes, a lot of new things have come in. Today, COVID treatment is much better. You have steroids, which were the core of treatment, saving lives. But now, early in COVID, we have this lytic monoclonal antibody cocktail. It has truly become a game changer. If you use it early in the first 48 hours, it is expensive in India. It is 59,000 rupees. It in selected cases like people who have obesity, people who have chronic kidney disease, people who have lot of comorbid diseases like diabetes, hypertension, heart disease, or they have cancer chemotherapy, or they have immunological diseases, or immunocompromised people, they can be saved. A lot of people are asking me a question that we want our second dose or third dose, or we want a booster dose. Why? Because they don't have antibodies. So I reassure them that now we have the lytic cocktail of monoclonal antibodies. It is like after you get a dog bite, we give a rabies immunoglobulin if you don't know whether a dog had rabies or not. Similar to that, we have this monoclonal lytic cocktail of antibodies, which we can give to people. If you give it immediately and early, it's expensive. It will make your likelihood of getting hospitalized much less. Of course, it doesn't help everybody, but it helps most of the people. And it is also effective against the Delta variant. Also, a lot of people have asked me a question that beyond this, what? Well, we have a lot of new drugs now. We have JAK2 inhibitors which have come in. We have immunologicals which are coming in. We have more and more monoclonal antibodies which are coming in. We have better ways of handling it. But still, once you get hit with COVID, once you get your lungs damaged with COVID, and if you have a comorbidity, COVID timetable is 3 to 4 months. Once you go home, it is 24/7 monitoring for the next 120 days. Remember, it is care, care, and care. And particularly, you have to monitor the COVID-7, which is the temperature, the pulse, the respiratory rate, the blood pressure, the glucose, the 6-minute walk test with oxygen saturation, and be digitally connected with your healthcare provider or your doctor. If you follow the COVID-7 mantra for the first 3 weeks in the acute COVID care, and then for 120 days in the full COVID care, that's the way to live. And we have learned to live with COVID more aggressively. Yes, Geeta Kulkarni is asking a question. What's the cost of the antibodies? The antibodies cost, a single dose costs almost 60,000 rupees. And usually it comes in a vial. So you need to give it to two people at the same time. So it can cost 1.2 lakh rupees. Of course, India is also making its own antibodies, and we are doing trials for the same. Sonal Jasraj Asar is saying chocolate is an antioxidant. It's a mood lifter, but you should have in small proportions. You're absolutely right, but it's a dark chocolate which makes the difference. But as Dr. Shetty said, don't keep the chocolate in the fridge because you keep on eating it again and again. So, Guru Anna, my question to you is now going in a little more serious note that people have got fatigued now. And there is something called pandemic anger. And pandemic anger is setting in now with people. It is festive time. People want to celebrate. Bappa time is there. And, government has put so many restrictions. A lot of people ask me, why you people are putting so many restrictions? I said, we are not putting any restrictions. It is COVID which we don't want to enter our houses. Bappa is welcome home. But celebrate virtually this year to celebrate physically next year is what I tell them. But this pandemic anger is the bubble of pandemic anger is gradually growing and growing, and people are getting angry. Guru Anna, how do you handle pandemic anger?
Well, in Ramayana it is said that during the 12 years of Vanvas, 14 years of Vanvas, Ram, Sita and Lakshman were in the jungle and they were practicing yoga, they were practicing meditation. So if Ram could manage 14 years of being away from the mainstream, living in jungles, eating fruits and berries, why can't we manage a few months or couple of years? So I think the challenge is, if you have to be mindful, you have to do something more. And even in eating, Dr. Shashank, yoga and vipassana makes you mindful of eating the right proportion because it trains your mind and reinforces the cognitive beliefs you have. So I would say that please practice meditation for bringing down your anger, and please practice meditation to win. Let the prefrontal cortex win against the amygdaloid. If the amygdaloid wins against the prefrontal cortex, you become patkal, mufat, and irritable all the time. That is number one. Number two, I said earlier that exercise is a mechanism to really beat your anger because you can't change the situation. The situation has to change around itself. And I heard Arif Muhammad Khan saying in the morning on Times Now that Onam opened up everything in Kerala and the numbers increase. So I would say be mindful of Ganesh Bappa. You can do digital arti, you can do digital prayers, and you can really feel Ganeshji inside your heart. And so do not crowd at all, and you'll find that irritability goes down. Prayers also bring down irritability. Now at the home, the most important person is the woman, is the mother, and let our mothers have sacrifice, have sensible breaks rather than sacrificing. And I always tell families that if you help the mother calm down, the family is calm, which means in Hindi, my famous sentence for the last 20 years is अपनी माँ को त्याग के घोड़े से उतरने दो, अपनी जिंदगी की मोमबत्ती दोनों बाजू से मत जलाओ, which means that let her not get consumed to take care of the family. Let her live and let her be imperfect. As Dr. Sharil, my friend, says, imperfect mothers would mean happy family, and imperfect mothers mean also a happy wife. So do you want to make your mothers a martyr or a manager? Is something we need to actually look at. And if you're able to really do this, if you're able to really do this, I think the family calms down because the serene face of the mother calms down the angry face of the father and the children. And it's so important for her to rest, and it's so important for her to be the manager in the house so that she allots duty. Now, apart from that, the elderly, I mean, above 60, what do they need to do? Because elderly also can get very irritable and also contribute to the anger inside the family. So they need to connect with people whom they knew before the pandemic. They need to connect with their old friends, their relatives, and people whom they like. And number two is they also need to be secure that the master key of their properties are with them and not handed over before they leave the earth. And number three, the healthcare should be very, very accurate. They need to go to the physicians and see to it that the medicines are titrated, the ECG is done, the sugar is checked. And as Dr. Shashank Shah said, meaning in life brings down anger. And if the family who have a lot of pandemic anger, again takes care of people around them who need them, again takes care of children who need some help in terms of education, again takes care of families who are very poor, again takes care of the maid servants who need vaccination, and that anger goes down. Dependence also for the 60-year-olds are also very important. A lot of 60-year-olds are very arrogant. Amala tumcha paise nako. Ami zagnar. I don't want my son to be generous towards me. Not at all. It's a cycle of life. You are generous when they were children and you were adults, and they are generous when they are adults and you are elderly. And that also is very important. Lastly, we need to also understand that anger can be a sign of depression. And it may not be only because of the pandemic. Pandemic may be a trigger. And there are some suicide alerts which we all need to see. And what are they? Number one is, I want to go to God. If somebody says that, do not believe that he has become more religious or more spiritual, that could be a suicide statement. You need to take help immediately and screen the person for whether the person is depressed. Anger can also be a sign of depression and thoughts about harming oneself. I want to run away from home is also a suicide alert and a statement. And you need to really screen the person for mild mental illness, stress, or for depression. I want to kill you or myself. I mean, that's a very powerful sentence. That's agitation, anger and agitation. You should differentiate Mild anger from agitation. Agitation would mean I'm tremendously restless. I can't stand at one place. I want to go up and down. I feel so angry that I want to hurt you or hurt me. And that is one of the most important reasons for attempting self-harm. And people need to be very alert to this, and also need to understand that they need to run and take the help of a mental health professional. Suddenly somebody wants to make a will. Achanak kyo yaar? And when my friend said my father suddenly went to an advocate, I said, bring him to me. And I found that he actually wanted to harm himself, and we saved his life. Suddenly, an elderly man went up to the terrace and said, I want to start walking. And the son was very happy. When I heard that, I said, suddenly, on the terrace walking, something wrong, get him. And we found that he had suicidal thoughts, depression, and a lot of anger. Existential thoughts among the elderly, very dangerous. My son is settled in USA. My daughter is in Ahmednagar. My responsibility is over. What is the point in living? Could be depression, could be anger. Listlessness and anger can go together and needs to be screened. Not going out at all. I still remember I got a call from the building and somebody said there's a couple elderly. They have not come down from the building for the last 3 weeks. I said, go, knock at the door. They said, no, it's their privacy. It's their choice. I said, no choice. It's an Indian family. Knock at the door and get in. And when they got in, they found they had not had food for 8 days. They were shifted to the hospital. Both were found to be depressed and then treated. Those who are having diabetes and other illnesses also are very prone to anger and depression. This needs to be actually checked and treated. Loss of spouse, loss of a wife causes more damage to the husband than loss of a husband to a wife in the Indian context. And loss of spouse also can induce a lot of sadness, a lot of anger, and that is also very important. Apart from that, I think what is very important is people get very, very upset when somebody talks about death and dying. I want to die. And they believe that I know my son for 25 years. He's scared of a cockroach. He will never harm himself. And then I tell them that suicide is not about courage or cowardice. It's basically a mental health thought. And I would like Anirudh to put that picture on suicide is not about courage and cowardice. And that I think is so important for us to understand. It's not what he was for the last 25 years. It's also what he is now. It's about the mental state. And I think a lot of methods can be used to bring down pandemic anger. But the most important method is Ram and Sita and Lakshman stayed in the jungle for 14 years, away from the world, and practiced a lot of meditation, a lot of yoga to help them get over their misery and remain mindful. So meditation, yoga, play, being together are some important ways, failing which you can meet a mental professional and take help.
Thank you, Guru Anna. Guru Anna, you have been simply awesome and wonderful. And as we are closing down, Pallavi Pinge is asking, knowing how to cook food correctly, eating it right amount of protein, complex carbs, good fats is important. But when you are looking at restaurant food, all this goes for a toss, and then you should eat slowly. Very true, Pallavi. You should do that. And Umesh Nisar is asking a very relevant question. That majority of the past pandemics ended in 2 years. Will it be same for COVID? Umesh ji, I wish your wish is true, and we'll really celebrate it. But one thing is sure, that between April 2022 to June 2022, probably a large proportion of the world will be vaccinated. There'll be exposure, there'll be antibodies, and we will have probably a disruption-free world without COVID. The single biggest announcement this week which happened, Guru Anna, was Denmark has unlocked everything, because more than 90% of their population is vaccinated. And therefore, we are seeing some geographies, some countries opening up completely. Let us hope and pray that next year we can celebrate our Ganesh festival with the fervor, with the festivity, with the zest, zeal, and vigor. Whether it is Eid, whether it is the Mount Mary festival, which is now happening, whether it is the festival of Ganesha or Krishna Janma and Dahi Handi, or whether it is Navaratri or Diwali, we can celebrate it in a COVID-free environment. And we all wish and pray COVID becomes endemic or it disappears from planet Earth. It is unlikely to disappear from planet Earth, but at the same time, we will have vaccination. The other big news which came this week is the company called Moderna is now developing a vaccine which is integrating flu vaccine and COVID vaccine. This is going to be the nature for the next future. You see, in the US, if you go, every year you take a flu shot. Similarly, with the flu shot, there will be a COVID shot. And that's going to be the next way to live it. But I think world is a better environment. Vinra going saying third jab is advised in Israel and USA. Well, in Israel and USA, it is advised for immunocompromised people. And we have to first get our first mile kept. India has done fantastic. 73 crore people have got the vaccination. But we need to ensure that we get both the vaccines done. Only 12.5% of Indians have got both the vaccines done. Milind loves food. I'm sure Guru Anna's batchmate Milind Kulkarni this is. What about sweet tooth for diabetes? We need mental discipline and control, but I still end up having a small sweet. I can't stop that habit. Then do Shatapavali. Immediately do physical activity for 15 minutes of brisk walk after that little sweet and burn those little calories of the sweet. We don't want to deprive you of the food, but what I would suggest is when you have that small bit of the piece of the sweet, feed it to other people around your family. Reduce it, portion control it, go slowly about it, and get free from this thing. We do not want you to deprave your taste buds. At the same time, we don't want to stimulate and kill your pancreas also. So we need to balance it. Diabetes is all about balance, it's all about controlled behavior, it's all about mindfulness, it's all about gratitude and a slow but certain path. As we are closing down, before I ask Dr. Anna for the final comments, Anirudh, if you could put up the slide of Ganesha, because it is Ganesh festivity time. And it is Ganesha's, it's technically not Ganesha's birthday, but still we all celebrate it like a birthday. And all of them are saying that have I done my RT-PCR test? Had I got my second dose? Are you vaccinated? So remember a couple of things. Sanitization is still important. It is not yet given up. Distancing is still important. And masking is still important. Please don't give that up and try to reduce crowds. And if you have gone and if you feel that you are having any symptoms related to flu-like illness, get your COVID data, do self-isolation, contact everybody and ensure that you do that. In Mumbai, what they have started doing is they are testing all the people in the societies. If 4 or 5 people come, they are sealing the society. Then after 5 days, they are testing all the members of the society for COVID test. And that's why we are seeing some spike in the Mumbai numbers. We wish and pray that next week, next Sunday is Anant Chaturdashi. By the time Bappa departs us, we don't want to welcome COVID back. We want to see the end of COVID. So my humble appeal is that during Bappa times, during Ganpati Bappa Moria times, do virtual darshan, online darshan, stay safe, stay healthy, and that's my only message to you. And of course, be in the right mindset. Pick up people who have these subtle signs which may cause suicide. That's what Anna has told us. Guru Anna, always as usual, you are unusual. And as usual, as you are unusual, you will have the last word. And once again, I thank Anirudh Sapatnekar for being persistent with us, tolerating me and Anna with all our eccentricities. And Anirudh is so busy. Last week, we had the Maza doctor from our Honorable Chief Minister and the task force, and he hosted that show. But now I request Anna to give his final Bappa blessings on us, and let us all pray that Bappa blesses us. He is the Vignaharta, and we can remove all the obstacles we have in our life. Anna, for your final comments.
Yeah, quickly, Mr. Nagaraj Rao says that parents are devastated. They hardly speak even to me. I think get small conversations, very innocuous conversations of childhood, of little happy things which they had experienced, and when they can share that, probably their anxieties will go down, and they would be able to share more. If not, let somebody else talk to them. Sometimes a new person entering the house and talking to them also helps. And then also check their parameters if everything is normal, and then if everything fails, no harm in seeing a psychiatrist, and that's important. And as we close, I would like to tell all people who believe that being slim and trim makes them feel good. I would like to say how you feel defines how you look. That would not mean that you need to really abuse your health, and that is so important for us to understand. And lastly, my dear friends, remember, time is not always the best healer. Fever will go down in 7 days. I will not see a doctor. My sadness and depression will go down. I will not see a doctor, is not what you have to say. Time is not always the best healer. Interventions are important, especially when we have 1 out of 7 people in the country mentally ill and 20 crore people mentally ill. And on top of that, we had the COVID epidemic. Thanking you all. Remember, Ganesh ji gives you inspiration, blessings, and wishes, but it cannot give you immunity against COVID. Immunity against COVID and the fight against COVID is to follow the rules of science. When the rules of science are followed, the blessings will work. But if the rules of science are not followed, blessings may not work. There's a difference between Ganesh ji's task and the task of task force and the doctor and our responsibilities towards ourselves. So this was Ganesh Chaturthi. This was International Suicide Prevention Day. There was International Literacy Day also, which happened some time back. It was International Physiotherapy Day also that happened some time back. And thanking you all for being here. We'll be back again 12 o'clock next week. And take care. All the best. Thank you.
Thank you so much.